sex should never, ever be painful unless you want it to be. Your pelvic floor is your body's trauma response muscle. Here's the kicker. For a woman to climax, the pelvic floor is absolutely integral. Like lots of things in women's health, it's still notoriously under-researched and underfunded.
Heather Foord, thank you for joining me here today.
Pleasure. It's so nice to be here.
Yeah, I'm very excited about this discussion. We're going to go places, I feel.
Oh, we are, babe, we are going places deep, very deep.
I love this for us. Can you just straight out of the gate start with telling us a little bit about you and how you really found your way in becoming an expert in women's pelvic health and even sexual health, or moving into that, right?
Absolutely. And I think like a lot of women my age, my career took a total 180. So I started out after school, I went to university and I wanted to be a writer. So I studied journalism. I was a journalist for about 10 years, freelancing, and then eventually became editor of a couple of different magazines. And it was during my last gig as a journo that I started working for a health magazine. Loved it, became really, really passionate and really intrigued into how the body works as a whole. During that time, I also had my 2 babies. So I went on mat leave twice. And after my second bubba, I went to a trampoline park with my toddler, who was about 2 at the time. And I went to jump on
the slippery slope. I already know where this is going.
Let me tell you, it's slippery. It was moist is probably a better way to say it. I went to jump on the trampoline with my toddler and I would have been about 3 or 4 months postpartum. And I jumped for maybe like 4 or 5 jumps. And all of a sudden I was like, oh my God, what is happening?
What they used to be.
Thank God I was wearing black tights is all I can say. I got off that trampoline and I was so bloody angry. I was angry at my own body firstly, which is not fair, but in hindsight. But at the time I was so angry with my body because it felt like it was failing me. I was angry with health professionals that I'd met along the way who never told me about prevention or told me what I was experiencing. No one ever warned me. And then I was also really angry at, I guess, the health system and the education system as a whole for the lack of awareness or education that I'd received in the lead up. I mean, there were so many touch points from high school to university, to the workplace, to, with my midwives. And at no point did anyone really sit down and discuss this with me. So I had a lot of anger. And I guess like any woman, we try and turn anger into something positive. I went on the search, first of all, to try and find treatment. And I had to drive, it ended up being over 2 hours to get to a place that offered treatment that was non-invasive and using tech because I was a mum to a newborn. I was very time poor. I wanted something that was easy to access and quick and effective. And it took me a 2-hour drive to get there. And the other part of it was I couldn't bring my newborn. So I was like, very inconvenient.
Logistical nightmare.
Totally logistical nightmare. The preparation required was immense, all of those things. And because I struggled so much to find treatment, I was like, you know what? I can't find it, so I'm going to make it. And that's where I started Corethica Co. So Corethica Co is, we have 4 clinics now across New South Wales, and we offer non-invasive, really quick, easy treatments specifically for women postpartum and postmenopausal, but it's all created for women by women. So we're kid-friendly, family-friendly. We make sure that our treatment sessions are about half an hour, so they're in and out. And also the results are, you see your difference within a week or 2.
Right. And so what are women coming for? What are the main signs for someone listening going, do I have issues? Like, I think not
necessarily. And I mean, this is
not everyone's jumping on a trampoline either, but also,
I mean, the biggest one is leakage, right? Incontinence, which we know affects a whopping 2 in 3 women. It's almost no one is really immune to it. So leakage and incontinence are the 2 biggest ones, and that can be urine or from the bowel. But
it's about the bowel. I don't know why.
Well, yeah, it's absolutely another part of incontinence. But the other aspect is sexual dysfunction. And we see a lot of women who are mums and also a lot of women in that postmenopausal stage that just have no libido, or they struggle to reach orgasm or climax, or they just assume that that's what their life is. And they assume that it's normal for them not to be able to climax or orgasm each time they have sex. So I think a lot of my education comes around explaining to women that sex is a really important part of your lifestyle, and also incontinence affects so much of your lifestyle that you don't have to live like this. The mental load involved of thinking about, do I have to pack a pad, or do I have to look for a bathroom everywhere I go? Or the mental load that comes from, oh, should I fake it tonight with my partner just to make him think that I'm enjoying it? That's not normal, and it's not something you have to live with.
Does it extend to things like painful sex, vaginismus?
It's all very much interrelated, and sex is such a multifaceted part of a woman's life. So I guess we could do a little explainer where let's talk about what the function of the pelvic floor is.
Yeah, let's do that.
It's so under or misconstrued or misunderstood.
Right.
So I think the first thing to understand is that it forms the foundation or the floor to 3 very important organs for a woman: your bladder, your bowel, and your uterus. Okay? Not only is it holding those organs upwards, but it also frameworks around your urethra, which is where you wee from, your bowel, where you poo from, and also your vagina.
Right.
Okay? So it forms that framework around it. And if a muscle is weak, it's loose or lax. Okay, so it means those holes are also going to be looser or laxer. Now, if we think about how that might apply in different scenarios, let's talk about sex, for example. It means that when you have penetration, you may not have the ability to grip as well as you would used to be able to grip, right? But it also means sensation during sex is probably not going to be there for you. And I mean, we don't really care about your partner that much, but for maybe partner as well, right?
Does that change? Sorry to cut you off, but does that change over time? Like, is it normal after, say, birth for a period of time for it to not be what it was before, but then it has the ability to go back to what it was before?
Yeah, so after you give birth vaginally, your pelvic floor is forced to stretch to quite a large extent. Obviously,
Right.
Bubby's head can be quite large.
Yes.
So it does take time to recover, but it should, in a perfect scenario, go back to what it was
How
previously.
soon after? Are we
Everybody is different.
different?
I know it's a crappy answer.
But like, if somebody's still blaming childbirth
Yeah.
2 years later, is
No.
that a reason? Like,
I would
what's the time frame roughly?
I mean, I would say 3 to 6 months
Right.
after you've
I think
given
that's
birth.
helpful because I think a lot of women still blame their pelvic floor on something that happened 5 years ago.
Totally, and that shouldn't be the case.
Right.
I would say 3 to 6 months after birth, if you are experiencing any symptoms or you're feeling like things down there are not comfortable or not what you want them to be, it's really important to reach out for help. It's not something you should have to live with. And there are some cases where the birth may be slightly more traumatic or there may have been tearing that can result in things changing down there more permanently.
Right.
But symptom-wise, if you are experiencing any symptoms, it's really important to reach out for help. So yeah, the other way that the pelvic floor works is if you can't contract it properly around those holes, it means that that's where the leakage comes into play, right? You can't zip up the pelvic floor to switch it off like a tap when you need to.
And then what about also other times? I personally feel like I notice things can be mostly fine, but then at ovulation it can be a little bit different, and then obviously the period time it can be a little bit different. Is that a thing?
Yeah, it's absolutely a thing. A woman's body is just
Wild.
so fascinating and so wonderful and so magic. So during certain times of the month, our estrogen levels increase. So during your period, you probably will find that if you have any symptoms of pelvic floor dysfunction, they may get worse during that time, not only because of the fluctuation in hormones that cause extra muscle weakness during that time, but also because of the extra heaviness in the uterus being swollen that's placed on the pelvic floor. So it can feel like you've got more pelvic heaviness or more droppage down there. So yeah, absolutely. It can
And then at
fluctuate.
ovulation, because the cervix comes down, I just always thought that lined up for me. I was like,
Yeah.
I can be
It's like extra pressure on the pelvic
completely
floor.
fine all month round, except the gym at the right time. I'll be like, oh, okay. But it'll usually be just before the period or at ovulation time. And then the rest of the time it's completely
You're fine. Yeah, absolutely. But what I would say is that if you are experiencing symptoms at any stage of your cycle, it's still a sign of dysfunction. And there's this wonderful little graph that we use and a lot of physios use as well. It shows that when you become symptomatic, you're already well on the progress to dysfunction. So at any time if you've got symptoms, it's showing there's already underlying weakness there. And it's so important to nip it in the bud sooner rather than later, because as we get older and our body shifts and our hormones change even more as we head into peri, things are likely to get worse, right? So we want to get a good foundation there.
Right. Is there instances where we're different just by the way that we are? Like,
Yeah, well, I mean, I like
Not-
to refer to the
yeah.
pelvic floor as any other muscle in your body. So let's remove all the mystery and hoo-ha around it just because it's inside your body or inside your vagina or above your vagina. It does not mean it's performs unlike any other muscle. So some people can be just more prone to having extra muscle. I mean, we can look at those girls in the gym who just naturally have a six-pack and you're like, how is this fair? Yeah. Some of us naturally just have stronger pelvic floors and others, thanks to mum and grandma, may not have strong pelvic floors. So it's called genetic predisposition. So a really good way to understand whether you might be at risk is to ask your mum or ask your nana if they've had any issues with prolapse or with pelvic floor dysfunction.
Yeah, prolapse is another thing, I guess, that we need to bundle in the same conversation, because I definitely know lots of women, especially after childbirth, have experienced prolapse, or as they've gotten older as well and had procedures.
Well, are you ready to be shooketh?
Yeah, go.
1 in 2 women who have had one pregnancy have prolapse.
Really?
Yeah.
What defines a prolapse?
That's another great question. And like lots of things in women's health, it's still notoriously under-researched and underfunded. So what defines a prolapse, what prolapse is when one of those organs that the pelvic floor is propping up starts to bulge through the vagina or the vaginal canal, okay? So in the very early stages of prolapse.
Kind of like a hernia.
Yeah, like effectively it does the same thing. It's like an extra buildup of pressure down there and a muscle that can't counteract that pressure. So the bulging starts. In the early stages of prolapse, generally we call that stage 1. It might just be the tiniest little movement or tiniest little bulge of that organ. You may not have any symptoms. You may not even know it exists. The problem is, as that prolapse, if it gets worse, it can cause issues down the track. So women may struggle with putting a tampon in, or the bulge may actually start coming out externally. They may have painful penetration because during penetration you're hitting the organ, not comfortable. But it can also cause things like leakage from the bowel or from the urethra. There are lots of different levels of prolapse, and prolapse can get worse if you leave it. But it can also, you can live your life having a minor prolapse and not even know about it. Now, this is where I try and empower women to know their own body, because I mean, most of us check our breasts for lumps, right? We look at our skin for cancers and freckles and changes. But when's the last time you gave yourself an internal and felt in the vagina, right? Like no one teaches us to do this. But it's so important to know your own body and treat your vaginal canal like you treat your breasts or your skin, because that way you can determine if anything changes, particularly when it comes to prolapse.
Yeah.
So do you want me to do a little explainer on how to do it?
Please do.
Amazing. Okay. So my hot tip is to do this in the shower, because I feel like in the shower, everyone's comfortable, we're relaxed. It's like warm, it's cozy. So
hopefully it's private. But
like, I mean, if you've got
children, it's probably not.
It's a family activity at that age. So what I suggest is in the shower, sliding a finger up the vaginal canal. And what you're feeling for is the lump or a bulge. If you have a lump or a bulge and it's not painful, just take note of it. Maybe call your health practitioner or physio just to let them know or get advice. But what you want to do is track that lump or bulge by doing this once a month, say. The other thing you want to test for is if you have any pain or if you feel any skin texture around the vaginal canal that feels off, feels different from what it did last month. Because now with things like pap smears, they're so spaced out, which is wonderful, but it means that no one's really down there looking for you. So it becomes even more important that you're aware of what the vaginal canal feels like, if there are any bulges and if those bulges get worse, if you have any pain. And also it's a really good opportunity to just have a look at the external part of your vulva and know what your vulva looks like, because as women, we're never really taught to embrace that part of our body. There's so much stigma attached to it.
Really is.
So let's break that stigma, get like that body awareness when it comes to the vulva, and even just send some like mental love to that part of your body, because it oftentimes doesn't get much.
Right. I think it's so important that we do that, because there's no one doing that for us.
No.
It's the same as breast health too. Like checking, I think from what I've learned is that no one's ever going to know your breasts as well as you are if you're actually palpating and aware of that area of your body and any changes that might happen. You're going to find them first if you're doing that.
100% agree. 100%.
So you talked about like you can have a bulge and then it can be a stage 2. Is that the right thing? Stage 3.
So it goes
then
from like
what does
stage
that look
1
like?
upwards. When we get to the bulge becoming external, normally that's kind of stage 3, stage 4. It can change throughout the day depending on whether you're standing or sitting a lot. So there's all these different factors. What I would say is the earlier that you can intervene and start preventing that, the better. So the bulge normally happens when the pelvic floor becomes weaker and looser, which means there's more space in that pelvic area for them to bulge through. There's no framework to support and prop them up. And that can be muscular, so pelvic floor muscle, or it can be fascial, which is pelvic floor, the fascia.
And that's something that actually can be treated.
Yes.
Without surgery. Often, like, a lot of women are having surgery. And I'm not saying whether that's right or wrong. All I see is the women that are like, that was the worst decision I ever made because now it's worse.
Yeah.
I'm sure there are women that it's better for, but
totally. Everybody is different. And I think if we're broadly speaking, what I would say is that prevention or trying to find other options that are non-invasive and have less risk than surgery is always the best way forward, right?
Yeah.
So there are treatments available to help strengthen the pelvic floor muscles to help alleviate prolapse in a lot of the cases, because with surgery, as I said, there's risk, there's normally quite a high cost, and the recovery time is not ideal. And to give you an idea of the stats, the success rate with mesh surgery for prolapse is sitting anywhere between 85 and 95%, whereas with the treatments that we offer in clinic, the clinical research shows in less than 3 weeks, it's a 95% success rate with no side effects. So, I mean, for me, it's an obvious choice.
Yeah, absolutely. I think that would be, it's so helpful for so many women because I think it's one of the things we absolutely ignore. We laugh about it. We have a bit of a giggle. We kind of go, oh my gosh, this gets worse as we get older, and we kind of have accepted that it's just the way it is.
I agree. And I sit on two sides of the fence with this because I love the fact that women are now more open about it, and they can kind of make light of the situation because they feel like they can have these conversations. But at the same time, it's like I feel like we're veering too far into the lane of just accepting that now, where it's like, no, you don't have to live with this gal. We want you to have the best, most amazing life as you get older. And as women, we're already juggling kids and careers and trying to look and feel our best. We don't need to be worrying about wearing panty liners every time we go to the gym.
Absolutely. Absolutely. So we've mentioned most of the symptoms. Did we leave any out?
Oh, good question.
So it's like leakage, pain.
Yes. So you can have painful penetration. That can be,
say that.
Yes, because you can have a pelvic floor that's too weak or too tight. Okay, so there's different symptoms and there's some crossover in symptoms. I think the most common and the simplest way to say is if you experience any leakage, that is a big sign. Any issues with sexual dysfunction, so libido, struggles with orgasm, and we can talk more about that too.
That's what my next question was. What's it got to do with an orgasm?
Okay, let me just quickly go back. So pelvic floor also connects to your tailbone and coccyx. So any sort of pain in the back, it plays a key role in. Actually, are you ready for another mind-blowing stat? Okay. And you guys can do this at home too. So I want everyone to flex their foot for me. Now, before you even moved your ankle, your body switched on a muscle subconsciously. Guess what it was?
What, my pelvic floor? Really?
Yes.
Wow.
How wild is that?
That's crazy.
So I think that's a really important thing to realize because it just shows you how important the pelvic floor is.
What else is it switching on? What else?
Exactly. If you raise your arm up like this.
Same thing.
Same thing, babe. Yeah.
Wow.
So that's how important it is when it comes to almost every single movement you make. Not even talking about running.
Sneezing.
Yeah, well, literally, like everything that you do
Definitely.
that requires
Sneezing,
stability.
Yes.
That's extra intra-abdominal pressure. You need to be able to switch that pelvic floor on to stabilize your entire body. There's so much misunderstanding of like, oh, but it's only involved in leakage. It's absolutely not, but that's just the easiest sign that there's definitely something going on.
Right.
Now, let's talk about the anatomy of the female orgasm.
Excellent.
This is another of my favorite topics. So, in the foreplay stage where things are feeling really good, you're starting to get sensation down there. It's called the sexual response phase, okay? Phase 1. So your pelvic floor switches on to help keep blood flow in that area. So it contracts to help keep everything nice and juicy and swollen and feeling good and plump down in the vulvar region. And then during the plateau stage of the sexual response, that's where things are feeling really great. You're really turned on. You're really liking where this is going. But it's almost like you hit this plateau and you just need a couple of minutes or some people a bit longer of continual foreplay to get you there. So during the plateau stage, that's when the pelvic floor's job is to do little butterfly flickers of contractions.
Really?
Just to increase the sensation down there.
Aren't we clever?
Here's the kicker. For a woman to climax, the pelvic floor is absolutely integral. Its job is to do a really steep relaxation and then a really sharp contraction. And it is the difference between those two movements that can get you over that hump to climax.
Wow.
So if you can't relax your pelvic floor properly or you can't contract it properly, it's going to be really hard to get over that hump to climax. And then when you hit climax, you know how you get these like waves of pleasure that start in the tummy kind of region and expand out, so you get a full body explosion or release. Those waves of pleasure all stem from the pelvic floor. So your pelvic floor contracts and releases at 0.8 of a second to get you this whole body orgasm. And that muscle, the pelvic floor muscle, sends a little message to every other body part to give you those beautiful sensations.
Because we don't really know that much about everything that happens at that point, do we? I mean, obviously.
Very much understudied.
It is.
Yeah. I think it was only in 2016 that the clitoris was finally mapped out. So isn't this, it's female sexual health is like.
Wow.
Wild.
So 9 years we've actually had some information.
Absolutely.
So
and
lucky.
Another little interesting fact is when they did the mapping of the clitoris, what they found was, you know how we talk about the G-spot? So obviously a guy, I think it was in the 50s or the 60s, came up with this G-spot. What they found is it's not actually a different part of the body that has all these extra nerves. It's simply a spot that hits the clitoris from another angle.
Right.
So the G-spot as it stands or how as it was understood is actually not correct.
So overrated.
It's, I mean, like most male things.
That's so funny. Well, it's not funny, but you know what I mean? Like, fascinating. Pelvic floor basically is like our life support.
Well, when it comes
Next
to
to the
sex,
heart
it's
and the lungs.
absolutely key.
Wow.
Yeah.
So interesting. I never even, we know it's important, but I think, like I said, we put it to the side. We're like, oh, yeah, that's just, something we deal with as we get older and eventually we'll visit it again.
I think especially going back to like female sexuality, it is so heartbreaking to me because I think sex should be such a wonderful, joyous part of life. And I think like so many women, especially after we've had babies or as we get older, we kind of turn our back on our previous like sexual, beautiful, wonderful self. And it's really heartbreaking. It's sad.
This is what I want to ask you as well, because obviously we have accepted, again, just like the pelvic floor, that as we get older, our libido goes south. And I've just got so many questions about that because is it that we become complacent? Is it that sensation changes because obviously our hormones change? Is it that the way that we feel about our partner is different? Like there's so many questions.
Yeah. And like I said before, it's so multifaceted and it could be any of those things. But what I would say is that sometimes or oftentimes it can be biologically related. So related to muscles or something else going on with your body. So identifying that can oftentimes mean that you don't have that struggle anymore.
A lot of women will say, I don't have a libido. And I will ask them the question, when you're actually intimate, how is it nice? Like, do you enjoy that? And they'll say, yeah, but I'm never instigating it.
Yeah. And this is another really interesting thing. So a lot of men have arousal that just comes on instantaneously, whereas women tend to be more responsive when it comes to sexuality or arousal.
I try and say to patients, it's very normal for you to not be instigating, but it shouldn't hurt. It shouldn't be something that is uncomfortable.
Yeah.
It should be something that you can actually enjoy in the moment, but you're just not thinking about the instigation. That's okay.
Yes. I think everyone gets arousal in different ways. And so for a lot of women, things like reading spicy books really helps, or watching a movie that turns you on is a great way to get involved. I would say as well that sex doesn't just start the moment that you and hubby close the bedroom door. Your foreplay can start the day before or the morning of by sending each other a lovely message.
Right.
Because I think for some women, not all the time, but it's not just about in and done. It's about this entire feeling of connection. There's a lot of emotion involved. And so you can start foreplay, as I said, straight away in the morning. You can read a book. You can read an article. You can look at a nice picture. You can send your hubby a nice message. It might be him coming home and cooking dinner and organizing the kids and saying, go have a bath. That can also be a really important part of foreplay and that responsive arousal. So finding what works for you. I do want to touch on the painful penetration because I hear this a lot, especially with young women as well. And what I will say is sex should never, ever be painful. unless you want it to be. So if you're experiencing pain with sex, there's something going on that you need to stop, rethink. The problem is that your pelvic floor is, I call it your body's trauma response muscle. Okay, so it holds a lot of trauma. And a good way to use an example for this is if you think about how you feel or what you do if someone's running at you and about to tackle you, or if you're in the middle of a road and imagine a car coming towards you, you brace in response to that. Your body naturally braces to try and protect all of your important organs. Your pelvic floor is the first thing to brace in that time. And it does that with perceived trauma, perceived stress or just normal stress, or physical stress or hurt, like physical hurt as well. So your pelvic floor braces in response to try and protect everything, but it's notorious for not being able to let go after that response. So if you're having sex and you're experiencing pain, your pelvic floor does what it's meant to do, and it braces in response to pain. But the problem is, we talked about this before, where your pelvic floor forms a framework around your vagina. So if your pelvic floor is braced, it means the vaginal canal is tighter and grippier. But the problem is that's going to create more pain, right? Because the tighter you are down there, the more painful penetration is going to be. And with penetrative sex, it really needs to be relaxed and lubricated. So women oftentimes get into this cycle that's really hard to break, where they have painful sex, their body braces in response to that pain, and then they come back again the day after or a week after and in response to perceiving sex and perceiving or expecting that pain, the vaginal canal and the pelvic floor grip even tighter this time because they're like, oh, it's going to be even worse this time. And then the next time they have sex, it's again going to go harder and tighter and more painful. And so it's really hard to break out of that cycle if you get into it. So I always say, if there is any pain with penetration, stop, try other things. And remember that this whole like historical understanding of sex as being penetration and finishing when the male comes is outdated and not true. Sex can be whatever brings you and your partner pleasure. So stop with penetration, try other things, enjoy each other's company in other ways, and just take penetration off the table until you feel like you're ready, until you are relaxed enough to try again.
Well, your body tells you that you're ready. Your body keeps score here, right? You can go, I want to do this, but your body's like, nope, I don't.
And I think it's another thing where it's like, what is that term? It's like, grit your teeth and think of England. Absolutely do not do that.
Don't that, but that's terrible.
Did I make that up?
No, it sounds like someone made it up, but I don't think it was you. But say, oh, wow.
So yes, absolutely do not grit your teeth and think of England. Take penetration off the table and find other ways to play.
For the woman listening, I feel like she's saying, how do I know if my libido's okay? Like, I feel like it's a question a lot of women just feel like they're not 21 anymore. And also relationships change, right? So
Completely.
It's very different. You're not going to have the same level. Tell me if I'm wrong, but my understanding is you're not going to have the same level of desire as you did when you're in that honeymoon phase of your relationship. Things do change.
Yeah, relationships definitely change. I think it's a really hard question to answer because libido is just such a sliding scale.
I think we put so much pressure on ourselves. So.
Yeah.
When it comes to this, that's what I'm trying to say.
Let's take away libido and talk more then about maybe fulfillment. And if you're questioning whether or not you're fulfilled in your sex life, then I would say it's probably a sign that you're not. If you have that question in the back of your head,
but I think also women their plates are so full that it's the last thing on their mind, which again contributes to the lack of instigation, where then they go, well, hang on, something's wrong with me because I'm not thinking about it and my partner is, and actually it's the last thing I feel like, right? There's kids, there's so many factors of things that are impacting spontaneity and all the things that you used to be able to do. I kind of just want women to go, that's normal. Like, that's a normal part of being either, if you have children, a mother or being a career person or whatever it is. It doesn't mean that there's anything necessarily wrong with your libido or your fulfillment. It means you have to actually give it some attention maybe.
Yeah, I would agree with that. I would say that there's always going to be stages in your life where sex is not a priority, but I think it is important to understand the effect of a good sex life on your overall well-being. and also how it can affect your relationship and your relationship with yourself, because sex does not have to be with a partner. Obviously, you can have sex by yourself. And so, yes, I think being gentle on yourself is really important, but also not deprioritizing sex because of you're being stretched in other ways. I think bringing back.
It's like anything you've got to give effort to.
Yeah.
Isn't it?
Absolutely. It also is almost like the more effort you give it or the more time you spend in your sexual, sensual self, the more you want to be there too.
Right.
Yeah. So I would say if you've had a dry spell for a while, it can be really hard to break that spell and get back into it. But oftentimes once you do and you have some really wonderful sexual experiences, you don't really want to ever leave that beautiful sensual part.
Do you think that women need to learn to ask for what they actually want? Like, is that half
and
of
not
it?
just in the bedroom.
No,
like, just in
this
general.
is very true. I would say in general,
absolutely.
100%. And equally, probably men should be saying what they want as well. I think this goes both ways. There's such a mismatch when it comes to needs.
Yeah.
How is anyone else going to ever know also?
Completely. Well, exactly. No one knows your body like,
Right?
like what we said before with checking yourself. So it's really important to know your own body before you start bringing someone else into the picture. But yeah, I think the asking for what you want in the bedroom is an issue that's rife across all countries, all demographics. Like women across the world have this same issue. And I think it stems from back in high school days. What was your sex education like in high school? Do you remember?
Horrendous.
Horrendous, right?
Yes, yeah.
There was no focus.
I went to a Catholic school.
I
weren't
went to a
even
Christian school.
allowed to talk about it. You
No.
told this is a condom and this is a banana, but you won't be needing it.
You won't use that. Yeah, exactly. And you're like, I'm so confused. It was basically like
and
that.
There was also just have sex fall pregnant. There was that as well. So
well, see,
you
mine
just weren't
was
doing
like Mean Girls. Do you remember that scene where it's like, if you have sex, you will catch an STD and you will fall pregnant and then die. And that was basically it. But even like moving past that, it was still so focused on the male. Like it started when the male had an erection and it ended when the male ejaculated. The woman is kind of just like the passive part of it. Right? The accessory or the vessel, which is so wild. So I think this all stems from that education that we received, like 20 years ago. Yes. And I think things are getting better. So I have so much hope for the next generation and for our daughters. I feel like we're moving forward in leaps and bounds, but it's still our generation that is constantly struggling with the understanding of what sex is and the realization that it's more than just male pleasure. It's about female pleasure as well. And so asking for what you want or knowing what you want is imperative to that.
And important for your relationship anyway.
Oh, God, yeah.
So we've talked about pelvic floor. We've talked about signs that your pelvic floor might need some attention. That's basically all of us. And obviously then sexual health and pleasure and libido and orgasms. What does someone do if they recognize all of this is an issue? What's the next best step? Like, what do they do?
The first thing would be ask for help. Right. So reach out. A lot of women now have a really wonderful women's health GP. That's always a great first port of call. You can reach out to a local women's health physio or a gynecologist for help. You can reach out to Cora Storco. Even if you're not in New South Wales, reach out to us on Instagram. I'm always there to help guide and even get you a referral to someone locally that I would trust. But I would say please be empowered enough to ask questions from your health practitioner, whoever they are, because I think this is another kind of issue that our generation has, and it's that we see a health practitioner as this very powerful knowledge holder, and we also put them on somewhat of a pedestal. So if they tell us to do something, a lot of the time we're too embarrassed to ask questions or to look like we're silly. So if something doesn't make sense to you, please always question it. If something doesn't feel right to you, please always get a second opinion, because you should be the one that's in power of your own body.
Absolutely. I think that's so important. I think we've given our health away or given the power away of that, expecting someone else to tell us when something's not right, which is why coming back to the examination in the first place, is the first thing that we should be doing.
Yep.
And then just so that people understand what treatment would look like.
Yeah.
Would that involve exercises? Would that involve like machine type of treatments? Like, tell us about that.
So in the Corethica clinic, like I said, I was very time poor. So I wanted tech that would treat me really quickly. So in the Corethica clinics, we have Emsella and Emsculpt, both of which are totally non-invasive, half-hour sessions. And like I said, with Emsella, it's a 95% complete success rate in less than 3 weeks of treatment, so 6 sessions altogether.
And what does it actually do?
So, great question. It uses electromagnetic technology to force contract your muscles for you. So it goes through almost 12,000 contractions each half-hour session. And to give you like an...
Sounds like a workout.
It is a workout, but honestly, there's no pain.
Right.
We're always pain-free. It feels like, did you ever get Braxton Hicks?
Yes.
Yeah, similar to that, where it's not painful, but it's like
it's tight.
uncontrollable contractions.
Yes.
And each session is, so if you do the 6 sessions, it's the equivalent to 6 years worth of daily Kegels that's prescribed by health sites. Is that not wild? Like 6 years worth of Kegels daily in 6 sessions.
And should people still be doing their pelvic floor exercises?
In between each session?
Yes.
They don't need to do that when they're with core. I would say that if you're not coming into a Corethica clinic, pelvic floor contraction and release is really good. And what we want to do is set women up with options to incorporate into whatever they're already doing. Because the last thing mums or working women out there need is to add something else to their plate. Like no one has time for that.
Although if they're able to jump on the trampoline or walk around the gym. I think people would commit to,
doing it. That's the thing. When I talk to women, I'm always like, what are you currently doing? What is your workout schedule like? Do you do yoga? Do you do Pilates? And then it's about teaching women how to activate and control their pelvic floor so they can incorporate those pelvic floor workouts into whatever they're already doing. We want it multitasking.
That is important too. I think that if I think about the difference between my pelvic floor like 10 years ago and now, the only difference is that I'm much more active and I've obviously it's definitely better. I'm only thinking about it because we're talking about it. I wouldn't think about it otherwise, but I guess if it was a problem, I'd be thinking about it.
Exactly. Yeah.
Right?
Agreed.
Like at least for the incontinence part of it, although there's other symptoms. Finally, before we finish, I just want to ask the question, can stress have an impact on the pelvic floor and worsen symptoms for women?
Yeah, absolutely. So let's go back to talking about the pelvic floor as a trauma response muscle. So it's really similar with stressful situations in your life. You brace your pelvic floor in response to stress. And actually another little tidbit, your pelvic floor and your jaw are connected by fascia. So oftentimes with stress, what do? We grip our jaw, we get really tight masseter muscles, we grind our teeth, and that then has an impact on the pelvic floor. So your pelvic floor can also grip and grind and tighten or spasm. And so we do that with stress. And like I said, the pelvic floor, it switches on, but it's notorious for not being able to relax, which is where some mindful movements really come into play. So things like stretching, like yoga, mindfulness, diaphragmatic breathing, all of those beautiful lowering of the cortisol level movements are really beautiful and wonderful for the pelvic floor and for stress as well by default.
So great. This has been very enlightening. Thank you so much for joining me.
You feel like you learned something?
I mean, I did. I learnt lots. And
wait, is the pelvic floor your new favorite muscle? That is my aim. My aim is to make it everyone's favorite muscle.
Wild how it's connected to so many.
Everything. Yeah. And so many fun, interesting parts of your body.
Yeah, amazing. Well, thank you for the work you're doing because I think all women need you and your information. So appreciate chatting with you today.
My pleasure.
Amazing. Before we go, I do want to just remind you that it would be so great if you went ahead and subscribed to the podcast. That means that we can keep on bringing you the guests that you want and the topics that you want covered. And I promise I will do a little happy dance if you do go ahead and follow wherever you're listening or watching.
Happy dance without leakage now, hopefully.
Thanks again for watching and until next time, bye.